Hi, I'm Dr. Steve Weiner from the Aesthetic Clinique in Santa Rosa Beach, Florida. And what I have in my hands here is the Coolsculpting device by Zeltiq. And this device was developed by physicians at Harvard after recognizing two phenomena. One was something called popsicle paniculitis. And popsicle paniculitis is when a kid puts a popsicle into his mouth and he leaves it there and it freezes the inside of his mouth. And what it ends up doing is causing some fat loss in his cheeks, and they get dimples. And that's called popsicle paniculitis. They noticed that the hole from the popsicle led to some fat loss in the cheek. The other case study they acknowledged was when a woman was riding horseback naked, and it was really cold that night, and she froze the inner thighs. And over the next several weeks to months, she lost fat in that area. So putting those things together, Rox Anderson and Dieter Monstead of Harvard Medical School devised an experimental device which they initially used on pigs to see if they could mimic the clinical findings in popsicle paniculitis in this woman. And they were able to find that they could remove permanently some fat in the treated area. And later it's been shown in humans that they could remove about 25% of the fat in the treated area. So what this device does is it attaches to the area of fat which you want to have reduced, and it uses a suction device to pull that fat through the skin. There's no breakage in the skin, it's all done non-invasively, so it pulls the skin and the fat underneath it into this vacuum, and it stays there for approximately 1 hour. And the device has these cool pads on each side which cool the temperature of the fat down to a certain level, which they know will kill the fat but will not harm any of the surrounding structures like the skin, the muscle, the blood vessels, or the nerve tissue. And so after the device is removed, the area could be a little bit bruised, it feels a little bit numb, but that resolves rather quickly. And then gradually over the next 6, 8, 12 weeks, the fat in that area is reduced. And there is no increase in the level of fats or cholesterol or triglycerides in the bloodstream, and they've proven that with blood tests. So the areas that we normally treat are the abdominal area, both lower and upper, as well as the flanks, the love handles, and the muffin tops. So this device has no downtime, can be repeated if the amount of fat you lose isn't the exact amount that you want. You want to use more, just do it again 2-3 months later. So this is a great device for people that just can't lose those last couple inches that have been going to the gym and are close to their ideal weight, but they just have trouble losing that last little bit. Right here we have Janice, one of our estheticians, and Hannah is going to demonstrate applying the gel pad, which is what you put on the skin first. And it's a little gooey, a little cold, and this is the area that she's going to treat now, and she's going to get the handpiece out, and that has a suction, and so she applies it to the skin and then applies the suction. And so what that does is it brings in the tissue into the handpiece, and then it starts cooling it down. It stays in that position for the next hour, and it cools the skin down. After about 3 to 4 minutes of cooling, you don't even feel this handpiece. And then in 1 hour, we'll take it off. So here's Janice now, about 30 minutes into the procedure. She's doing fine. The handpiece is still attached, and it's cooling her fat down to that temperature that kills it, but not the skin or the surrounding muscle. Now the handpiece has been taken off. There's a little redness in the area. There possibly might be a little bit of bruising, which is not a big deal, but it can occur. And Hannah is going to come over and do a little bit of the massaging that we do. And that seems to increase the fat loss after the procedure. But that's basically it. Janice is free to go home now or go to the gym, ride a bike, whatever.